My name is Shantavia Griffin, and this is my video essay submission for the endocrine glands. This is my illustration. Okay, we have the pineal gland, the parathyroid, the pancreas, the testes, the ovaries, the adrenal glands, the thalamus, the thyroid, the pituitary gland, and the hypothalamus. And this is the thymus, I'm sorry. With the anterior pituitary gland, it releases the growth hormone, also abbreviated as GH. The target areas are the liver, muscle, bone, and cartilage mostly. The effect of the growth hormone stimulates body growth and protein synthesis. It mobilizes fat and conserves glucose. With the posterior pituitary gland, one hormone release is oxytocin. The stimulus for release is through nerve impulses from the hypothalamic neurons in response to cervical and uterine stretch or suckling of an infant. Target glands are the uterus and mammary glands. The effects are powerful uterine contractions during birth and stimulates milk ejection in lactating mothers. Another hormone is an antidiuretic hormone, also abbreviated as ADH. Stimulus for release is also through the nerve impulse from the hypothalamic neurons in response to increased blood solute concentration or decreased blood volume. The target organs are the kidneys, and it stimulates the kidneys to reabsorb more water, reducing urine output and conserving body water. The thyroid, one hormone, it releases the thyroid hormone, abbreviated as TH, which stimulates the release of the thyroid stimulating hormone, abbreviated as TSH. The target area are most cells in the body. The effects are to increase the basal metabolic rate and regulates tissue growth and development. Calcitonin is another hormone released. The stimulus for release is high levels of calcium in the blood. The target areas are the bones. There is no known physiological role in humans, but when the hormone is supplemented at doses higher than normally found in humans, it does have some pharmaceutical applications. The parathyroid hormone release is the parathyroid hormone, abbreviated as PTH. Stimulus for release is low levels of calcium in the blood. Target areas are the bones and the kidneys. Effects increases blood calcium by stimulating osteoclasts and by stimulating the kidneys to reabsorb more calcium. PTH also stimulates the kidneys to convert vitamin D to calcitrol, which is required for the absorption of calcium in the intestines. The pancreas, one hormone release is insulin. The stimulus for release is increased blood glucose levels through the parasympathetic nervous system stimulation. The target is most cells in the body. The effects accelerates the transport of glucose into body cells, promotes glycogen, fat, and protein synthesis. Another hormone release is glucagon. Stimulus for release is decreased blood glucose levels through the sympathetic nervous system stimulation. Target areas are primarily the liver and adipose. The effects accelerate the breakdown of glycogen and glucose, stimulates the conversion of lactic acid into glucose, and releases glucose into the blood from the liver. The adrenal gland, one hormone release is mineral corticoids, mostly aldosterone. Stimulus for release is the angiotensin II, release and increase potassium in the blood. Target areas are the kidneys. The effects increases the reabsorption of sodium and water by the kidney tubules, increases the secretion of potassium in the urine. And another hormone release is the catecholamines. Stimulus for release are nerve impulses from the preganglionic synthetic fibers. Target areas are most body cells. The effects mimics the sympathetic nervous system activation for the fight or flight response.